Hello everyone, my name is Jaro and I'm from Slovakia. Today we are going to talk about children and their drug addiction. It is important to address several key points like prevention, risk factors, and the role of education. Firstly, we would like to talk about children and vulnerability to drug addiction. Children and adolescents are more vulnerable to effects of drug addiction because their brains are still developing. The prefrontal cortex, responsible for decision-making and impulse control, doesn't fully mature until around the mid-20s. This makes young people more susceptible to risk behaviors, including
Hello
experimenting with
guys,
drugs.
I am Sevde Çoktutal from Turkey. I will continue with risk factors. There are several factors that increase a child's risk of developing an addiction. The first one is environment. Growing up in an environment where substance use in common can normalize drug use for a child. Peer pressure, lack of parental supervision, and exposure to trauma or stress are major environmental factors. Mental health issues is the second one. Children dealing with anxiety, depression, or other emotional issues may be more likely to turn to drugs to cope. And the third one is genetics. Some children may be genetically predisposed to addiction, especially if there is a family history of substance abuse. We will continue with third one, the importance of early prevention. Preventing drug addiction in children starts with early education. Teaching children about the risks of drugs in a way that's age appropriate and relatable is key. Programs that involve parents, schools, and communities working together tend to be more effective. It's crucial to build children's self-esteem and teach them coping mechanisms to deal with stress, peer pressure, and emotional
Hello, I'm
challenges.
Martina and I'm from Italy. I'm going to talk about the role of parents and educators, and then I'm going to talk about the signs of drug use in children. Parents play a critical role in preventing drug addiction. Open communication, monitoring children's activities, and creating a supportive environment can help protect them from risky behaviors. Schools also contribute by offering drug prevention programs and providing safe spaces where children can talk about their concerns. Now, I will continue with the signs of drug use in children. While it can be difficult to spot the early signs, parents and caregivers should be aware of changes in behavior, such as sudden mood swings, withdrawal from family, declining school performance, or changes in friends. Physical signs may include changes in eating or sleeping habits, unexplained weight loss, or secretive behavior.
Hi, my name is Ioana and I'm from Romania, and I will continue with how we will get help. If a child is struggling with drug addiction, early intervention is critical. Counseling, therapy, and family support can make a huge difference. There are specialized programs designed for young people to address the root causes of addiction and help them to recover. So, as a conclusion, addressing drug addiction in children requires a community effort. Parents, educators, and health professionals all play a role. The key is prevention, early detection, and providing support for children who are at risk or already struggling with substance abuse. By fostering open communication and promoting healthy alternatives, we can help guide children towards safer, more positive paths.
Stop addiction before it starts.